Today's project is reverse tummy tuck, reverse abdominoplasty, and then a little mini abdominoplasty or tuck down at the bottom of the abdomen. This is our patient's chest here, that's her breast there. And our patient's awake. You awake?
I'm awake.
Patient's always awake during these procedures. And there is, when our patient stands up, all this looseness of skin, which she doesn't want. And one could make an incision from down below, way up here, and try to get all that pulled down, which is a traditional tummy tuck. Then you have to move the belly button. Or one can, instead of pulling down, one can lift up. And after all, the skin is falling down from up above, so why not lift it up above? And we can tuck it right here underneath the breast fold, so it should hide, heal, and be very nice after it's all settled out. With all cosmetic procedures, very important for people to be patient. There's a healing time, and each procedure takes a different amount of time to heal and to show you the final result. Obviously, with surgical things, it takes more time for it to settle out, for the numbing fluid to get reabsorbed, and for the stitches to get dissolved, etc. Probably all of our stitches today are going to be underneath the skin, and so probably no stitches needing to come out. We do see our patients for these reverse tummy tucks the next day, and then maybe in a week or so. Not too much downtime. I think some activities should be curtailed. For example, afterwards, it's not a great time to be doing sit-ups because the skin needs to be quiet as it's healing. You don't want to be stretching on the skin. So for areas that have surgery, good to leave those areas alone without extra tension or stress on them during the healing period of time. And also nice, especially for some things such as face neck lifts, eyelid surgery, not to be doing things that'll raise the blood pressure, maybe for a week or so. Otherwise, not really much downtime. There's no lounging around with any of our procedures. Patients should be up and about and doing probably mostly of what they usually do. Buckley, Milford, MD. Remember, today's project is reverse abdominoplasty and also a little mini tuck on the bottom. I've completed the reverse abdominoplasty on this right-hand side with the incision being placed in the inferior mammary fold, so between the breasts. There are no incisions that are between the breasts. These inferior mammary folds are beneath the breasts. This side is numbed and ready to go. My upper incision is going to be here, and then I'll take these and bring them up. Also, what I do is tailor tacking, same as always. So I use these little tackers and little clamps, and I grasp on here and then fold the skin up when I'm ready to make sure that what I propose to take off will actually go back together again, and I know it will. And the project is working to get rid of some of this loose skin, but up here underneath the breast. So we'll be elevating this looseness upward this way, as I've done on this side already. That's it, reverse tummy tuck. Normal tummy tucks down here on the bottom, they might be mini, they might be extended, they might be extended a little more, they might be high tension lateral advancement where it comes up a little higher and we really pull things in. That's down here at the bottom. Sometimes people have so much loose skin that it can be brought all the way down here. So more traditionally, maybe an incision up here with the belly button then being moved because that skin winds up down. Today's patient is going to have an absolutely normal looking belly button because it's absolutely normal. It's in its normal position, which is kind of right at the level of the top of the hips, the so-called as-is or anterior superior iliac spine. So the belly button will stay the same, and yet there will be skin tucked down from below and also from above. Richard Buckley, Milford, MD, and team. And patient, right?
Yeah.
Awake the whole time except for when you slept?
Yes.
And comfortable and excited?
Yes.
And no general anesthesia. We just numbed the areas we worked on. You'll remember today's project was a reverse tummy tuck. I'll show you that in a second. And then a little mini lower tummy tuck. So that's the mini. There are no stitches on the outside. Everything's on the inside. We'll put some super glue on there in a minute. Dermabond, it's medical grade super glue. And yeah, that'll heal up beautifully. And you can see it looks very nice. Can you zoom in on that? Mm-hmm. You all zoomed in? All right, that's good. And then this is the area where we did the tuck on the top, and stitches are all under the skin here as well. And there's a reverse abdominoplasty. You remember there was some skin drawn way down here. It's now tucked up in there. And it's scalloped a little bit for a while. In other words, pleated, because this length of skin is much longer than that length of skin. Skin has to go somewhere, so it's pleated in there. It will be totally flat and totally smooth after it's finished healing up. So reverse abdominoplasty, and then I showed you the lower mini, truly mini tummy tuck. And the skin is all nice and tight here now. All right, thank you for watching another episode of Milford, MD.